Hello, everyone. This is Dr. Evan Levine. Today, we're going to talk about COVID and hypertension and 2-minute cardiology. But first, I'm wearing one of my favorite shirts, Minnesota Nursing Association, in support for the great nurses in Minnesota. Now, hypertension and COVID. Wow, what's that? Well, hypertension is known to increase the risk, especially poorly controlled hypertension, increase the risk of adverse outcomes in COVID. It's very important to make sure your patient, when you check them for COVID, that they don't have hypertension. And if they do, that if it's very elevated, that they see a healthcare provider as soon as possible and get that under control. Now, in the beginning of COVID, we were all told that maybe ACE inhibitors and ARBs, because they increase that ACE2 receptor where that COVID viral particle gets into the cell, might increase the risk. They increase it through, regulatory mechanisms. But that's not true. Studies have shown that taking ACEs and ARBs actually for hypertension probably reduces the risk because you control blood pressure. So it's important that anyone that comes to see you with COVID get their blood pressure checked. And if it's elevated, that they see your provider to make sure it's controlled. Now, if they're over 65 and have Medicare, they can enroll into the remote patient monitoring program. We use a product called AccuHealth, which, because it's incredibly easy to use and has a great portal, and you can actually read patients' blood pressures through a portal several times a day. So if they have Medicare, you should enroll them into a remote patient monitoring program, get them seen right away, and everyone else should see a provider as soon as possible, because many of these patients, well, they may not have even seen a healthcare provider for years and only came to see you to get their COVID checked. And perhaps they've had hypertension for many, many years and didn't know about it. And now we know that those patients have a much higher risk of having an adverse outcome. That's 2-minute cardiology. I hope that helps.